Hello, and welcome to our afternoon local portion of our virtual symposium. We represent the Southeast region of the United States, and we just wanted to provide you with specific connections, support, and strategies specifically for patients with ACPMP, as well as caregivers. I'm Cheryl Sizer. I'm a physician assistant at the Wake Forest Baptist Health Surgical Oncology Clinic. There we have the privilege of serving many patients with appendiceal cancers and PMP. And our goal is, of course, to provide excellent medical care, but also support and long-lasting relationships with our patients. Since 1991, we've been offering complex surgeries, including HIPEC. The Comprehensive Cancer Center has been a high-volume, HIPEC, and cytoreductive surgery center for decades now, and we strive to take those lessons learned from those experiences and improve on current patient care. We're so honored to serve patients from all over the country and abroad who seek the expertise of our highly skilled surgeons who have collectively performed over 1,700 HIPEC procedures. We have a multidisciplinary approach to care, which includes not only the surgeons, but also our medical oncologists, radiologists, pathologists, researchers, genetic counselors, nurse navigators, psychologists, and clinical staff. And all of us are very committed to providing individualized treatment plans. As an NCI designated center, we can focus on the needs of our local community. We provide early access to clinical trials, education, and outstanding outreach programs. As you've seen here today, we enjoy a very positive relationship with outside institutions, working together, coming together to discuss the most up-to-date knowledge-based medicine and research. Here at Wake Forest Baptist, we embrace a holistic approach that focuses on quality of life and overall well-being. And with that, I'd like to introduce the director of our survivorship program, Dr. Stacy Wentworth. And thank you once again for joining us, allowing us to journey with you in your healthcare. And I want to remind you as well that you will have the opportunity to chat online with us, ask any questions that you might have. So thank you and welcome, Dr. Wentworth.
Good afternoon. Thank you so much for having me. I'm Dr. Stacy Wentworth, Medical Director of Survivorship at Wake Forest Baptist Health. I just wanted to go over a few questions that we get commonly from our cancer survivors, and I'll leave some time available for questions as well. I really think cancer survivorship is all about empowerment. It seems sometimes during the treatment process, so much of what we do is talk to you. And now in survivorship, it's time for you to talk to us. The problem is that sometimes when patients talk to doctors, things get confused. They sometimes feel like, hey, that person's he or she isn't listening to me, or what I think is important is not something that the doctor seems to be important. For most of you who are in any sort of relationship, this happens. Communication difficulties like this happen to all of us. And when a patient is entering survivorship, figuring this out and great ways to communicate with your doctor becomes so important. Also, a little bit wanted to touch on managing uncertainty. So one of the interesting things that happens at the end of treatment, and you all can attest to this, and I think that with this pandemic, we are experiencing some of this with you, is just uncertainty. During treatment, there was a plan, there was treatment, you were getting chemotherapy, you were getting surgery. This is what was happening every day. Sometimes I explain it to patients as if we pick you up on this train, the train is going in a direction. Once you're done with your treatment journey, we stop, throw you out, and we move on with the rest of the patients that are now either starting treatment or in the midst of treatment. What I think is so important is to look at yourself in this new reality. So the train has moved on, you're in this new reality, and I think that can lead to a lot of mixed emotions, and those emotions can change at any point. The thing about uncertainty, though, is this feeling is completely normal. As you talk to other cancer survivors, It's just something that we experience. As humans, we are not naturally good at managing uncertainty. We live in an uncertain world, but the way that we respond to that is trying to control that as much as we possibly can. We control the temperature, we control where we live. And I think it's important as cancer survivors to know that that uncertainty will lessen over time. If you think about other times that you've had uncertainty, putting your children on a school bus for the first time, allowing your teenage child to the first keys to the car, and that first time they drove away from the house, not knowing what would exactly happen to them, starting a new job, or even doing presentations like this, where it's uncertain how the audience will react to what you're saying. It's important for you to know you have done all you can do. It's important for you to continue to be an engaged partner in your care. But as far as the treatment of your cancer, you've done everything you can do. Also know that we will be with you. Even though we're not seeing you as frequently, we're not seeing you every week, we're not seeing you every month, it may be 3 to 6 months, we are still an important part of your treatment team. Your surgeons, your medical oncologists, your navigators, we are all still here for you. And also, again, managing uncertainty is something you have done before. So think about times where things have been uncertain in your, as these examples I've talked to you before, moving, starting a new job, managing the uncertainty of a child going off to college. All of these things required you to manage uncertainty. And if you go back to those times in your life, sometimes it's helpful to think about the tool belt that you built to deal with that uncertainty and how that uncertainty lessened over time the further you got away from that uncertain event. In speaking with your doctor, I have found that it's helpful for patients to know these 3 phrases. These are all red flags to me that wave and say, hey, when a patient says these things, this is something that I really need to key in on. And I think when a physician is sometimes in the room, there's pages, there's telephone calls, there's you, a family member jumps in. I think it's really important to know these 3 phrases and to test them out on yourselves and think about which one works for you. The first one is, I need to tell you something that will help you take better care of me. That to me is a screech, stop, look around, look at the patient and say, okay, this is something really important. The second thing, or the second phrase you can think about for yourself is, I am struggling with some feelings and I don't know what to do. Is there someone here who can help me? And the last phrase is, this is important. I really need you to hear this. I found that phrase is important in many relationships, but especially with your physician. This again sort of stops the conversation, puts a pause in, and says, I as a patient think this is important, and I want you to stop and really address this with me. As we are your physicians, we're sifting through all the data that you're giving us, and there are things that we are looking for. It may be that that doesn't seem important to us, or it's not a sign of disease recurrence, or it's something we don't hear commonly. But just because it doesn't raise a red flag to us that something may be going on with your disease process doesn't mean that we can't address it. And sometimes it's as simple as saying, hey, no, that ankle pain that you have, that's probably related to the basketball game that you played or playing with your grandchildren in the yard. It's not something to do with your cancer, but it's important that you hear that and you have the opportunity to address that with your provider. The last thing that I'll share with you is that I think it's really important in survivorship to find your A team. As you go through treatment, your team becomes your providers, your nurses, your navigator, your family, a few trusted friends or support people. And that's important. You have to know or maybe be aware that as you move into survivorship, your A team may change. You may need someone who agrees to walk with you every day. You may need someone who can give you motivation to go on. You may need someone in this group of people that you can call or you can Zoom with as you come upon an important milestone, like your 6-month CT scan. knowing that you need an appointment with that person to say, hey, this is going to be a hard day for me and I'm going to need your support. Can we just check in together? It's sort of moving from our specific skill set, which is disease treatment, maintenance, and monitoring for recurrence, to saying, hey, I have other needs in survivorship that are less about treatment for my cancer, but more about dealing with the emotional or the physical side effects of that treatment. And I would encourage you to look around and think about what you need, that A team may not necessarily be the same people that supported you or the same treatment team that you had as you went through treatment. This may include physical therapists. It may include pelvic floor rehab therapists. This may include, again, this support group that maybe as you were going through treatment wasn't as important, but now as you move into survivorship, have the skill sets and have walked this journey with you that you may need to go on and live your life. I think it's really important for patients to understand survivorship is the transition from illness model to a wellness model. We did not treat you to just be in a cancer center and be cancer survivors. We treated you so that you can go on and out into a normal life, or as normal as it can be after this diagnosis. So really thinking about, where is it that I am right now after treatment, and where is it that I want to be? And how do I find the people that help me get from here to there? And then identifying and putting markers down to say, this is where I need to be at these different places along the journey. So I encourage you, again, think about the skill sets that you had in other moments of uncertainty. Learn those 3 phrases, and also think about finding your A team who have skill sets that will allow you to move from illness to wellness. I'm so honored to be with you here today. I think this is an amazing group of people, and I'm totally open to your questions. You can drop them in the chat, or the moderator will take them. Thank you again, and thank you for inviting me to be a part of this amazing symposium.
Hi, my name is Joyce Fenstermaker. I'm a navigator here. And 2 patients that I approached were so willing to share their story and give encouragement to others. The first video that you're going to see is from Elizabeth Beth Henderson. She is a longtime survivor here, and she is very humbly willing to tell her, share her experiences. And the second person is Mr. Robert Conley, and he is a more recent diagnosed patient, and he's going to also tell about the importance of support team, having support in your life, and what that meant to him. So please listen to these videos, and I think you'll learn a lot like I did.
Hi, I'm Beth Henderson. I'm a 15-year survivor of appendix cancer, PMP. I'm here today to tell you about surviving. I want to tell you a little of my story of how I got to this point. In 2004, I went to a local hospital here in Winston-Salem, and they found a mass, and they call in a surgeon and admit me to the hospital and tell me they're going to do surgery. And I went with all that, and he says he thinks it's coming from my appendix. Well, I was 45 at that time. I advised the doctor that age 31, I had a complete hysterectomy, and that doctor told me he took my appendix. Well, maybe he did, maybe he didn't, we don't know. But they could not find the records, and that doctor that I loved dearly has since passed away from cancer. So they admit me, tell me in 2 weeks they'll do the surgery for that. So I get the drain. I stay in the hospital a few days, draining fluid for days. There was so much fluid in there. And so then 2 weeks later, I come in for the surgery to remove my appendix. And that doctor did the surgery, and 2 days later in the hospital, he comes in and tells me, you have MRSA. And he opens this big wound and tells me that they need to drain it and pack it, and there's no wound vac in those days. Today we have those. Most people know what they are. Well, 2 days after that, the doctor comes in and sits on my bed and tells me, we got the diagnosis back and you have a very rare cancer. It's appendix cancer, mucinous adenocarcinoma. You need to go through a lot more than you have been through. And I say, I will survive it. Okay, let's go. Let's do this. And he says, I'm going to send you to Dr. Levine at Wake Forest. I just finished my fellowship with him. He's one of the best in the world. He's world renowned. He knows all about this cancer. We can't take that here. So I go home for 2 months. I get better. The day before Thanksgiving in 2004, I met Dr. Levine. I knew then he was my hero. I would survive. He advised me of what the surgery entailed, and my husband and we scheduled everything for January scans, surgery February 7th. Super Bowl Sunday, my team's not in it. Don't matter. My team is with me. I'm going to survive. Dr. Levine advises my family. My surgery went very well, and I don't even have to go to ICU. I'm going straight to the floor. That was a big thing, especially back then. I survived, and I'm surviving today, and I'm living. So I get through all of that, those baby steps. I had to learn to eat. I had to learn to do everything over again. I would take a few steps a day. In a week, I would take a big walk. So you take those giant leaps after you take the baby steps. You need to do that. You need to do that to survive. Back then, there wasn't many ways to meet people or know what you were going to be going through with this big surgery. Since then, things have changed dramatically. I met so many people from around this great country of ours coming here to Winston-Salem to see Dr. Levine and his team for this treatment. And I encourage them, survive, live. You have to take baby steps. They turn into giant strides. They turn into big leaps. And to this day, 15 years later, I'm still taking those big leaps. And yes, things aren't always easy, but we've survived every day that we've lived so far. So we can move forward doing that. And survivorship is an honor. It is a privilege. And every day is a gift. Open it. Live your life, survive, and encourage other people. I come over here to Wake Forest. I found many people through the Facebook group that are coming here for their surgeries. And so I'll come over, I'll meet them, I'll bring them a gift bag with things I know they're going to need, things that they're going to need to prepare themselves for what they're getting ready to go through. I don't think anything prepares them for this surgery. It's bigger than anything. And I bring my husband. He talks to the families. He talks to the support systems that people have. As my support system, he encourages them and tells them what to look for and what to do to help their patient, their family, their friend, their loved one who's going through this. And I'm proud to say that things have got so much better in the 15 years. There's more survivors. People are living longer. People just encourage each other and survive. If you have the chance to make somebody smile today, do it. That helps everybody survive. Survivorship means a lot to me. I appreciate the opportunities that Wake Forest gives me as a survivor to meet these patients. I am an ambassador for them. And if you need to speak to anybody about that, you can get to me through Wake Forest Ambassador Program, Joyce Fenstermaker. She can get you in touch with me, or you can join one of these Facebook groups, because survivorship is so important. And Wake Forest takes the whole person, and they want you to survive. They want you to live. They want you to. And they'll do everything in their power to help you with that. They look at the whole family, not just you as a patient. They look at all of us and what we need to survive. I appreciate your time. I love you. I want you all to survive. And as I always say, I got your belly.
Hello, my name is Robert Conley, and I am a 54-year-old father of 3, and I was diagnosed with peritoneal cancer on Friday, April 12, 2019, and underwent cytoreductive and HIPEC surgery on July 11, 2019 at Wake Forest Baptist Health. Additionally, as a precaution, I started chemotherapy, FOLFOX, on September 11, 2019 and finished my 6 treatments on November 21st, 2019. I have had 4 CT scans since I completed my chemo treatments, and they have all shown no signs of recurrence. Thank you, Dr. Edward Levine, and all the wonderful people at Wake Forest Baptist Health for all you do for your patients and for your community. Thank you, Joyce Fenstermaker, for reaching out and letting me tell my story at this Appendix Cancer Survivorship Symposium. I've always considered myself an active and healthy person, and I take care of myself by exercising regularly, eating well, seeing my primary care physician each year to ensure that I am healthy. At the time of my cancer diagnosis, I weighed 175 pounds, and at 6'3", I was fit, had completed an Ironman, multiple marathons, and loved endurance sports. My symptoms, seemingly innocent at the time, had surfaced with tightness and discomfort in my upper abdomen, almost a feeling of a slightly pulled abdominal muscle, and some accompanying swelling and pushing out of my belly button. That was in late February 2019 and lasted into March, and I attributed the symptoms to some mountain biking falls and strenuous activity that I had experienced. However, the symptoms persisted, so I visited my primary care doctor, and after examination, he referred me to a GI specialist for a CT scan. Alas, I received a phone call after the scan that notified me that I had malignant ascites and something called peritoneal carcinomatosis. The kicker is that this cancer almost certainly did not originate in the peritoneum, so I had stage 4 cancer. This is not the phone call you want on a Friday afternoon, nor on any day for that matter. The story of my cancer diagnosis, treatment, and recovery really begins with support group number 1, my family. My incredibly special family, my wife Carmen, my daughters Bridget and Ailish, my son Owen, my brother Michael, and my former wife Anne, and my dog Lola, were and remain my primary and critical support group. Not only did they provide moral support and love, they inspired me and gave me a reason to hope and work and endure when at times it's hard to do those things. I'll take more time and talk about the specifics and important things Carmen provided me along the way in a little bit. Support group number 2 consisted of my friends and extended family. These important people came to visit in the hospital, at my home. My colleagues at work supported me. My extended family were there for me at all turns. They encouraged me and lifted me up when I struggled, and I did struggle. Support group number 3 were the medical professionals from Roper St. Francis, Charleston GI, Medical University of South Carolina, and Wake Forest Baptist Health, who provided world-class medical services for me. I am honored to have met Dr. Edward Levine and to have provided him a canvas and for his team and him to work on. His amazing surgical expertise and vast experience with cancer patients like me provided me with the confidence needed to get through this challenging time. I'd like to present some of my key takeaways and observations from my 17-month and counting cancer journey. Takeaway number 1, you cannot choose your immediate family, but you can choose your spouse. This person plays an incredibly important role, and Carmen was and is my confidant. We stayed up nights, we talked, we cried, and we planned. We hoped, and mostly she supported me by being incredibly positive for me. However, let's not mix up positive with overly positive, as Carmen is a realist, and we both wanted the facts, and we wanted to know how to address the problem and face it head on. Carmen, using her determination and intellectual skills, she's a talented writer, researcher, and top-notch information analyst in the development world, was able to do the legwork to help me understand what we faced and what were our next steps. As you can imagine, or might know, there is so much messy, unsorted, inaccurate, partially accurate, out of date, half correct, out of context data out there to stumble upon on the World Wide Web. Carmen cut through all of that and was able to provide me with the right articles to read, the clear studies, the data points that helped in decision making and relieved me of those daunting duties. It was teamwork, and it made both of our lives better as she contributed her research and analysis, and I was able to avoid the information overload that would have occurred otherwise. On a related note, my former wife Ann also played an important role as she and her family supported me, cheered me on, lifted me up, and completely removed any familial responsibilities from our shoulders. Great teamwork again, and as they say, it takes a village. Maybe that's theme 1 for surviving cancer. It takes a village. Takeaway 2, have a support staff, that is, friends with you for the surgery. Carmen had a great friend, Maura, that took notes and helped her post-surgery with the flood of information, and also with helping her keep her mental health. We also had great friends help us out, and Jen and Mike, specifically Mike, slept in the room and took notes and helped me understand what pain meds were working and what was really going on. Jen, Mike, Mara, and obviously very specifically Carmen were there for me all the time, and it was greatly appreciated. Also, my brother Michael was there, and he is also part of this incredible team. Takeaway number 3, do not underestimate the impact of your body adjusting to the new normal and the need to adapt with dietary and GI changes. The surgery is impactful, real, and terrifying, but the hard work comes leading up to the surgery and months after the surgery when uncertainty presents itself. The hard parts are not knowing what to expect prior, and the surgery is surely a critical milestone, but it's only part of a more challenging longer-term voyage to long-term health. Make sure you schedule time with a nutritionist, and they are available in the hospital after the surgery, and you'll likely want to see one when you're home recovering. If you have chemo post-surgery, as I did, this is even more important. Takeaway number 4, recovery from this surgery is not linear. Be ready for and accepting of changes and new information. It happens fast. Takeaway 5, do the things you love with the people you love. When you're recovering, pick an event that you would enjoy, even if it's a stretch physical event, like a 5K or a half marathon, as I did with my friends. It gives you a chance to get back into the game. Your friends cheer you on. You feel good. You hurt some. You feel the camaraderie. You feel alive. It's part of the healing process. Carmen and I also followed through with our original plans to attend Austin City Limits Music Festival with our friends Mike and Jen. That was a godsend. Takeaway 6, accept help from those that offer, specifically from friends and family. People care for you, but they feel helpless, and by offering them a task, such as watching the dog for a few days, cooking some meals, or contributing to a related cause, it gives them a lifeline and makes them feel great and helps out the cause for you. Takeaway 7, get a second opinion. Dr. Levine suggested it, and we took him up on it. We got one from MD Anderson, and it cost some angst, but it was worth the effort. Each diagnosis of appendix cancer or PMP probably has a good many similarities, but I am convinced each person's situation is unique and presents its own challenges, and differing opinions might help you consider something overlooked or take a different perspective. It was helpful for us. Takeaway 8, keep your sense of humor. It's critical. Takeaway 9, maybe some quick things to purchase or consider purchasing during your recovery. One of the things I addressed was I needed a better fitting wardrobe. I had lost weight, and weight that I wasn't really capable of losing. I had lost it. So I bought some clothes that fit me better, and that helped me mentally. Also, someone's recommended a bidet for those bathroom challenges. I think that's a great idea. But an adjustable and comfy bed, good books, and magazines are critical. Looking back on the experience with a bit of perspective, there are some things that we felt that could be improved and that caused us some frustration or disappointment. I'd say frustration 1 happened pre-surgery. We did not know the source of the peritoneal cancer, and I went through several tests to find out the primary source location. Each test brings plenty of anxiety as your imagination can run wild. If faced with a similar situation of uncertainty regarding the primary source of the cancer, please go to a peritoneal specialist like Dr. Levine fast, like do not wait. Within a few minutes of seeing me, Dr. Levine posited that the primary source was the appendix and that he would schedule a laparoscopy and we would know for sure within days. Why had I gone through incredible ups and downs of multiple inconclusive tests when we could have done one test and that could identify the culprit? See the expert early is my advice. Frustration number 2 happened post-surgery. More time should be spent on discussing the goal and plans for the long-term roadmap to recovery, including nutrition and GI health. Carmen and I had important, big picture questions that didn't seem to be on anybody's mind, such as what challenges could lie ahead for me given my new medical condition. Couldn't or shouldn't somebody draw a simplified picture of the before and after and the impact of the GI surgery? In my case, my appendix, gallbladder, spleen, omentum, and sigmoid colon, along with parts of my stomach, were removed. There are impacts to these changes, and it really would benefit the patient to get a crash course on those impacts. I got ideas and possibilities and definitely some information, but I feel that improving this information could have been a game changer for us. On that, this lack of visibility into ways to achieve long-term health played out in a few frustrating situations. One example, in January of this year, I became anemic and was diagnosed with increasingly low red blood cell counts. It caused me a period of lethargy and lack of progression that was frustrating. It took some time to resolve, but was ultimately resolved with iron infusion. And after a CT scan and colonoscopy, it was determined that I had an ulcer, not uncommon for stomach surgery, and that might have caused the iron loss. Another example is that I had a bowel movement challenge or challenges that eventually led to an ileum in an emergency hospital visit this past August. I consider their possibility as the new normal. I do not think I should have been surprised that my low iron count was probably caused by an ulcer that was a result of surgery. I should have known the word ileum before I was diagnosed after a scary emergency hospital visit that included vomiting, intense pain, and an emergency flight from South Carolina to Wisconsin for my wife. Why was an ileum such a scary event for me when it should have been a condition to keep an eye out for? In summary, one of the challenges with fighting this appendix cancer is the relatively limited amount of data that exists and the infrequency of occurrence of this cancer. There is a reason it's called a rare cancer. So having experts like Dr. Levine's staff and the information they provide, it's incredibly important for a successful recovery and for a full life. I understand it is difficult to strike a balance of getting all the information needed to address the challenges to a successful surgery and post-surgery, but it also requires some coordination and focus on longer-term wellness. After my cancer diagnosis, my primary care physician, Dr. Robert Teachman, told me that I had been training for this all my life and that I was ready for the fight. What an incredibly powerful thing for him to say. And although I cannot say I had been training for this specific purpose, I was ready for a grueling physical and mental challenge. However, I've come to realize the real challenge is finding the perfect storm of family, medical expertise, and a village of friends. Thank you for your time, and I wish you good health.
Hello, my name is Joyce Fenstermaker. I'm a nurse navigator with the Wake Forest program here. And my role as a nurse navigator is permits me to see a lot of patients with appendix mucinous neoplasms. I've met a lot of patient support team as well, their family members. There are a lot of common concerns that patients have, but the barriers to their care is often as an individual as the patients are. Some of the common questions patients have ask me right at first after diagnosis is, where do I get knowledge about appendix cancer, or how I'm going to pay for this? How will this diagnosis affect my job? And where does all my paperwork go? What physician do I need to see for my treatment? Navigators are a resource to you. Many NCI centers have navigators that see patients and their family members to provide a resource to you. And they're equipped to connect you with other people to answer your questions, your specific needs going forward. And along the flow of your treatment, whether that's chemotherapy, having surgery, or so forth. One of the most common questions is financial concerns. What I challenge you is to know your insurance policy. Every state's different. And you'll get a card, your insurance card, and on the back of that is usually a customer service number that you can call. Call them, make sure you understand your policy and know your out-of-pocket expenses. If you're having surgery, just know that the institution has pre-authorization personnel that connect with your insurance to get that authorization. Many insurance policies do not cover the one-time chemotherapy used during the HIPEC procedure. Many folks get a denial letter. Know what that denial letter says. It might be denying the whole surgery. If so, there's an appeal process. Your physician can help you with that. Your support healthcare team can help you with that appeal. Also, there is maybe just the denial of the chemotherapy. And that chemotherapy is important for during the HIPEC procedure, but it's a nominal fee in the big picture of things. So know what your denial is for. If you cannot work and you have to file for Social Security disability, I wanted to share with you information about the Compassionate Allowance list. The Compassionate Allowance, many folks with appendix cancer have a diagnosis that it has spread in the abdomen, and it's called peritoneal mucinous carcinomatosis. And that is a condition, if it's on your medical record, you will be able to have that expedited through your application process and work with your physician to understand the details of your health condition. Resources. We have a lot of resources, and your treatment team is a resource. Connect with other patients. I often connect patients with questions to other folks that have had surgery or appendix cancer. There are reliable organizations, ACPMP, I mean, I can't say enough. PMP Pals, Facebook, local support, cancer.net, carcinoidorganization.org is a good one for those who have appendix with a carcinoid. There are links to rare diseases. There are caregiver support. My goodness, we have a lot of that. Reach out to those. For instance, Tracy Sparks is a wife of a patient who wrote this book called Helping Her Spouse Beat Stage 4 Cancer. That is such a good resource for caregivers. And I challenge you to read the RAISE Family Caregivers Act passed in 2018. It gives you guidelines on caregiving and the organizations as mentioned. You know, you're not alone in all of this. We have so much support. And I challenge you to know the expectations your team has for you, but also share your life goals, your expectations with your treatment team, because that is so important to understand everybody on the same page. And I think you've heard today about your family and support staff. It's so important. Please reach out. You're not in this by yourself. The next topic will be about your health and how we're going to suggest your wellness. And I'd like to introduce Stephanie Thornton, nurse practitioner for this symposium. Thank you.
Hello, I'm Stephanie Thornton. I am the nurse practitioner here at Wake Forest in the surgery oncology department. I work primarily with all of the general surgery patients, take care of most of our appendiceal cancer and PMP patients. I've been with surgery oncology department for over 5 years. I provide care to patients in the clinical setting. I also make recommendations and address questions after our cytoreductive surgeries and our HIPECs. I help to manage all of our patients doing follow-up and visits, and over the years I have developed some standard recommendations for the most common questions and concerns for patients with appendiceal cancer and patients who have been treated with cytoreductive and HIPEC surgery. Following a cytoreductive surgery, the body undergoes many changes. These changes can be permanent and depend greatly on the extent of what is removed during cytoreductive surgery. The basic functions of the organs most commonly involved in cytoreductive surgery: the small bowel, which is about 20 feet, consists of initial digestion, helps to reduce the acid content. Acidity of the contents is where digestive enzymes are introduced and is responsible for absorbing most of the nutrients coming out of the stomach. You have the large bowel, which is about 5 feet long and is responsible for producing and absorbing electrolytes and forming and storing feces. The omentum, which is the adipose tissue or fat, provides limited peritoneal immunity and helps to provide protective covering or a curtain for the organs of the abdomen. The spleen contains white blood cells that fight germs and infections, and it also helps to control the amount of blood in your body and destroys old and damaged cells. The gallbladder also assists with digestion by producing, storing, and transporting bile. Bile, which is produced by the liver, is used to break up and digest fatty foods in the small intestines. And the pancreas assists with digestion and management of the blood sugar. 85% of the pancreas role is to provide digestive enzymes. Most commonly used chemotherapy during the HIPEC is mitomycin C and oxaliplatin. We've already discussed that it is distilled through cannulas in the abdomen and kept at a constant temperature at 40 degrees Celsius or 105 degrees Fahrenheit. Here at Wake Forest, we circulate it for about 2 hours. There are typically minimal chemotherapy side effects. Most of the chemotherapy used in a HIPEC is washed out at the end of the procedure, and within a few weeks, the chemotherapy in the HIPEC has been excreted from the body. A single prospective randomized trial for appendiceal cancer has been performed, which found mitomycin and oxaliplatin have the same efficacy. An oxaliplatin HIPEC had slightly better quality of life duration during the first month. Management of the cytoreductive surgery has very common concerns for our patients. Digestive changes and elimination pattern changes are the most often noted. After removal of the small bowel and/or portions of the large bowel, more liquid stools could be expected. Imodium and fiber are the first approach to control this. We attempt to develop a schedule that is assistant with giving the patient more control. If more control is needed after the initial approach has been tried, there are prescription drugs that can be utilized as well. Controlling bowel movements provides better absorption of nutrients, reduces the risk of dehydration and malnutrition, and over time greatly improves the quality of life. Some people also find probiotics to be helpful. If the gallbladder is removed, foods that are high in fat will become more difficult to digest. If there's a portion of the pancreas removed, digestive issues and issues with controlling your blood sugar can occur. Specific types of digestive changes can require enzyme replacement therapy. Blood sugar changes can be managed with your primary care provider. It is recommended to get a hemoglobin A1C test at least once a year. This blood test provides a record of how well your pancreas is able to control your blood sugar for the last 3 months. Another important health management issue for patients who have had their spleen removed. As I mentioned before, the spleen helps to fight germs and infections. Living without a spleen is safe. The spleen's duties are taken over by the liver and the lymph nodes and the other organs. You were given vaccines at the time of surgery and at your post-operative visit that help to fight pneumonia, meningitis, and H influenza type B. You should receive a yearly flu shot and follow up with your primary care provider to get boosters for your MMR and your DTaP. These protect against measles, mumps, rubella, diphtheria, tetanus, pertussis, and polio. Booster doses are suggested about 5 years after your spleen has been removed. For women who have had their ovaries removed, you should follow up with your gynecologist to discuss hormone replacement therapy. For most patients, hormone replacement therapy is safe. Adexisan is recommended about 5 years after your surgery if your ovaries have been removed. This provides information regarding the density of the bones. The younger you are at the time you lose your ovaries, the higher risk you have at developing osteoporosis. Mammograms every year, beginning at the age of 50, and continue with Pap smears based on guidelines unless a hysterectomy has been performed, then discuss further with your gynecologist. Long-term health management is a priority to our patients. Weight management, regular exercise, high-quality nutrition, and a well-balanced diet all provide, along with proper hydration, provide excellent health management. Avoiding tobacco products and excessive alcohol use. Colonoscopies every year are recommended for all fit appendiceal cancer patients. Yearly checkups with your primary care provider remain important. Oncology follow-ups should not be used in lieu of regular primary care provider visits, but as a supplement to them. Long-term health management also includes doing all of the things that make you happy. This provides for an improved mental health management and creates lasting memories. Most important is routine follow-ups with scans and blood work with your surgical oncologist. This allows to help them monitor you properly and provide the best recommendations as needed. Thank you for allowing me to speak today, but more importantly, thank you for allowing us to be involved in your care. I hope the information I have provided today answers some of your questions and also gives a framework to help manage your overall health needs.
Thank you so much, Stephanie. And thank you guys so much for joining us today. It has been a pleasure spending the day with you. I'm sure you have many other questions which can be answered on our sponsors webpage. They have a slew of amazing information for you. And then please look at the links that we're going to send you in an email after the symposium. There's a bunch of local links, links to survivorship, links to our sponsors webpage, which links to links to links. So a plethora of information that will be so vital to you. And once again, we want to offer our support to you. If you have any questions, you can reach out to me or Stephanie or Dr. Levine. We're all here for you, and we're so blessed to know you. And we just want to encourage you that you are not alone. We're here with you.